both members of the board and also supporting staff and agencies. And those who are listening online or watching online, welcome to all of you. One thing I want to make note of is that April is National Child Abuse Prevention Month. And in particular, Friday, April 4th, which is today. Oh,
you can go ahead now.
Okay, good morning, everyone. Welcome to the April meeting of the Children's Cabinet and Trust Fund. Members of the board, staff, agency representatives, and those watching online, welcome to all of you. I want to start by announcing or recognizing the fact that April is National Child Abuse Prevention Month, and in particular, today, Friday, April 4th, is Wear Blue Day. So thankfully, Melissa tipped me off ahead of time so I could put on the blue jacket instead of the tan jacket. So I am in uniform. And if you don't have blue on at the moment, if you have an opportunity to change into some kind of blue attire later in the day in recognition of Child Abuse Prevention Month, that would be appreciated. There are materials available. You see them there on the slide. So get a hold of the folks at Kansas Children's Service League if you want more information or materials. With that, we'll move on into our agenda. First item is approval of the February meeting minutes. And as in the past, my intention will be to adopt them by acclamation, providing there are no additions or corrections. They've been mailed out to you or emailed out, so I will give you a moment to consider any changes, and then we'll proceed. All right, hearing or seeing no changes or recommendations, the minutes will stand approved as written. Next item is the main item of our agenda today, and that is the early childhood block grant recommendations. Melissa, I'll turn it over to you.
Thanks so much, Don. I appreciate it. So good morning, everyone. This is a important milestone every year in our cabinet work. Today, we will entertain funding recommendations for the Early Childhood Block Grant Program. Before we get into the specifics of the slate this year, I do want to provide some overall context. As a reminder, funding for the Children's Cabinet is sourced from the Master Tobacco Settlement annuity that was entered into in 1999. At that time, the Kansas legislature created the Children's Cabinet as the organization intended to oversee the use of the funds. They converted our original Children's Trust Fund into the Kansas Endowment for Youth in '99 in that legislation, and created the process. The legislature appropriates line items in a budget known as the Children's Initiative Fund, and statute directs the Children's Cabinet to administer the use of those funds and evaluate the programs receiving funding and all of that. So we just wanted to put some context around why we're here today entertaining the proposals that we're entertaining. Lindsay, we can move to the next slide. This, as a reminder, this is the proposed CIF budget. It will need to be updated just a little bit once the state budget is signed into law. We always wait because there's still a few days left in the legislative session, and if there are any adjustments that need to be made, obviously there needs to be time and space to update things, but this is the budget as proposed, and it shows you on the green side of that circle, we um, you can see that the inner ring is the state agencies that receive funding. It's the funding totals transferred to each of those agencies. The outer ring shows the slices of the pie, so to speak, and the amount that gets transferred. The blue side, the left side of that circle, is the children's cabinet. And today we're talking about the navy blue slice that's highlighted there, the early childhood block grant. It is the heart of children's cabinet funding. At our June meeting, we will entertain budget recommendations for FY27. Looking ahead, we're going to need to make some important decisions about those recommendations due to the decline in the outlook for the tobacco annuity. So we'll save those conversations until that meeting, so we don't get sidetracked here today. But anyway, I just wanted to set the scene, give you this context, and so Lindsay, we can move on to the next slide. So what is the Early Childhood Block Grant? This is a longstanding program of the Children's Cabinet, adopted many years before my tenure with the board or my tenure in the legislature. It dates back earlier in the 2000s. It is a program that was designed to be community level grants to support programs that serve children birth to 5 who have identified risk factors and their families. It is solely funded through the CIF, through the tobacco funding, and statute created around at the same time as the cabinet was created. Statute put in place direction that the cabinet shall review, assess, and evaluate all uses of the monies in the Children's Initiative Fund. Lindsay, we can move to the next slide. That statute goes on with some specific direction that institutions of higher learning, of higher education, and appropriate research entities identify best practices, and that the measure, you can see the language on the screen, to measure and otherwise determine the efficiency and efficacy of practices utilized in our programs, projects, etc. So to that end, you see all year long in the work the cabinet does, the support we get from the KU Center for Public Partnerships and Research for what we call the overall accountability process, which speaks to the entirety of the CIF portfolio. We received the accountability report at the June meeting before our budget discussion, so that is top of mind as we engage in those budget discussions. All recipients of CIF funding participate in that process. But it's important to remember that anything that passes through to the other state agencies is not subject to the same level of evaluation that we apply to the programs that we manage here at the cabinet. So for ECBG, we have Wichita State University engaged to do the ECBG grantee evaluation. They developed, the research team at Wichita State developed an evaluation approach that we call the Common Measures Initiative. We move to that slide, Lindsay. The Common Measures Initiative is designed to provide a common set of measurement tools to help us evaluate across the portfolio in a consistent manner. So we have on screen, you can see the tools that have been adopted in this program. Not every program is subject to every evaluation tool because they are calibrated to evaluate different things. So if you are a home visiting program versus a programs in classroom setting. For example, you are going to be using different measurement tools. If you're a parent education program versus, you know, a program that is delivering services to the children themselves, it will. So we have a whole explainer for these that we embed in the process. So potential applicants can review the information pertaining to the measurement process. They have that information available up front with the RFP, so that if there are any questions about whether or not they wish to proceed with applying for funding, they can get clarity and understand what they're agreeing to as a criteria of our funding. You heard from Wichita State in October. We typically aim for August, or October at the latest. Somewhere in that window, we bring you the annual report, so that, again, but ahead of the annual cycle for ECBG, we are equipped with insight into the results of the evaluation. Our team, Christy from our staff, works with the Wichita State evaluation team to conduct annual site visits. We provide ongoing technical assistance to ECBG grant recipients. We make sure that they understand how to implement the common measure tools that they are required to implement. We help them interpret the data that they have from their evaluation, and the site visits are designed to help them utilize the results from that process for ongoing program improvement. So this is something that doesn't just take place once a year. It is all year long. It is part of it's embedded in the fabric of the ECBG program. We can move on to the next slide. So we have goals outlined in the RFP for the program, so applicants understand the goal of what we're trying to do. Primarily, we're hoping to provide direct services to children and their families who are at risk of entering kindergarten socially, emotionally, or academically unprepared for success. We follow statute, and we seek to fund programs that are evidence-based and data-driven. We also prioritize, as mentioned, a program with identified risk factors, so that we can increase access to services for underserved communities. We require community collaboration and support, so successful applicants bring matching funds from their local level, public-private partnerships, and all sorts of evidence of support from within the community. We've also worked very hard to make sure that we align with the goals of the All In for Kansas Kids strategic plan, and that this is all designed to improve access for families to the services that they need for their children. Our review process is also really detailed, in that we want to make sure that ECBG funding is supplementing to fill the gaps that exist, and not supplanting where other forms of funding exist, or duplicating effort for programs. So we do a lot of review of those issues before we get to our slate of recommendations. Next slide. There are a number of requirements for ECBG that I've mentioned some of them: the cash match, the fact that we want to make sure programs are serving at least half of the children and families in their project plan are the folks that meet the risk factors, gap funding, and that there is a demonstrated understanding of the common measures piece of all of this. We can move on to the next slide. This is the overall timeline for the process, and we've given you a 1-year picture. So here we are. In April, we bring the slate forward. We mostly even this year, the budget process is not complete in the state legislative process. So until we have the final budget signed into law, nobody will receive formal legal notice of their award. The decisions made today will be, we hope things hold, things look good, that, we are within the budget is with the governor for consideration. So stands a very good chance of moving through without further changes. But until it is legally the FY26 budget, we do not move forward. But we do need to get approval of the slate as there's a process there. We need some time to process the documentation for making grant awards. So that's why our April meeting, not our June meeting. We come to the June meeting with, as mentioned, the annual accountability report for the CIF. We then engage in board discussion and determination of budget recommendations for the next state fiscal year. So this June 7th or June 6th this year, we will be entertaining the FY27 budget, but we met June 7th in 24 to determine the recommendations for this budget cycle. October 4th, you received, or the process for this round of ECBG was approved by the board, the competitive RFP process rather than a simple renewal process for existing grantees. We also received the ECBG annual report at that meeting. November 18th, we opened the application window. That window closed. Applications were due by 5 p.m. on January 8th of 25. And here we are, April 4th, entertaining the slate of recommendations for FY26. That window of time in between January 8th and April 4th, we conducted all of the stages of the review process, and we put together the slate of recommendations. We can move on. During the application window, we strive to make sure that anyone interested in applying for our funds understands the parameters that we put in place, that they understand what the RFP is asking for, and that they receive any assistance necessary to help them successfully complete their application. So that includes a webinar that we host to kick things off and unveil the RFP, if you will, and take questions from those attending. We record that webinar, we post it on our website. We keep an FAQ document. We create an FAQ document and we keep it up to date as questions come in that we think more than just the one person asking might benefit from. Those questions get posted in the FAQ document on our website. We keep track, and this year we had 97 requests for technical assistance. They fell into two basic categories. Most were specific to the RFP and specific budget questions from applicants. There were 86 of those, and we tracked 22 hours of TA provided. The Common App is the grant platform that people use to apply for our grants. There were calls that were specifically support needed to get set up to use the grant management platform and create their profile, that sort of thing. So that was 11 requests and totaled only about 1 hour because it is pretty user friendly. So that's the background on what goes on during the application window. Lindsay, we can move to the next slide. I want to get to the heart of the discussion today, which is our slate of recommendations. So we received 44 applications. We are proposing a slate that will fund 25. Our total amount requested was over 41 million. We don't have that kind of money, so we have a slate that is just over $23 million worth of grant funding. we will reach 80 counties in Kansas. The counties highlighted in blue. We, obviously we would love to move this map to every county served, but it is a struggle to balance the available funds with the reach of the grantees in our program. We do take geography into consideration as one of the factors. So we do the best we can. We've got multiple grantees that serve multiple counties, so we do appreciate the work that a number that our portfolio of grantees deliver for the state. Okay, so that I want to give, before we move on to the slate itself, I just want to do some framing. Given that resources are finite, we really had to use some rules for, not rules, but the guiding principles were to review the internal budget proposals, and there are certainly variables that play into requests for increases from existing grant recipients, the type of program changes that people are proposing, and the like. But I will say 15 existing grantees are recommended to either receive the amount they asked for or a 10% increase. We took the lower of the two. So if they asked for, that's why you see in your prep materials different percentages that are less than 10%. There are some who are getting what they asked for. Some are flat funded, some reflect a slight decrease, and there are some that are getting the full 10%. We've got 2 new grantees on the slate, and we have recommending cutting one of our existing grantees from the portfolio this year. So some tough decisions were made. You guys have the detailed prep document. So Mr. Chair, I'm gonna stop here. The next 2 slides, it's at 25 grantees. It's too much detail to squeeze into one slide, but we have 2 slides that can show the slate on screen while we're discussing, but I'm gonna turn it back to you, open this up for board discussion, and I can offer insight if there are questions. You're on mute, Mr. Chair.
Sorry.
Okay.
While you have the map up on the screen, I have one quick question. The counties that are not included in the recommendations, are any of those served in any way by neighboring counties?
Well, no, I can't say they are, because we've tried to highlight, one of our grantees serves that quadrant of Southwest Kansas, highlighted in blue. I think that, Ness, Hodgman, Ford, and Clark represent the eastern border of their program reach, I think. So no, but they are served in other programs with other sources of funding in other ways. So they are not without services entirely. It's just not through the early childhood block grant.
Okay, all right, thank you. Questions or input from board members? All right, seeing none,
it looks like we have a question from Christy.
Yeah.
Sorry, Representative Williams. Sorry.
Yes, Representative Williams.
Yeah, I got my little hand up there. So Melissa, out of our list here of 25 selected, you said that 2 are new and 1 was cut. So from that list, would you say that the majority of these are reoccurring year after year after year? And if so, how many years would some of these be receiving these funds? And is it mostly operational costs that they're receiving this reoccurring funding?
I'm not equipped to speak to how many years certain grantees have been receiving funding. We do have some anchor programs. Russell Child Development Center serves Southwest Kansas. Live Well serves Northwest Kansas. Family Conservancy in the Northeast. The Opportunity Project or TOP Learning Center in South Central, and then the center in Southeast Kansas, to name just a few. I think these programs provide major service for families. We are not, we when we work with grantees for the budget, we are striving to provide direct services for families and their children. So I would say there's certainly a staffing and certain types of overhead woven in, but it's cost necessary to deliver the services. So we support quality improvement in classrooms. We support the personnel who provide parent education, or the different types of services that are provided. We do work very closely with our friends at KSDE to ensure that none of this, I can tell you with certainty that none of the programs on our list of proposed grant recipients receive the Kansas Preschool Pilot funding. So there's no duplication with that program. We also, Parents as Teachers is very well funded. We are not funding the same services that Parents as Teachers funds. So we strive to ensure that our funds are filling need and wrapping services around the programs that are serving our families.
Okay, well, I just have two more questions. One of the goals is to increase capacity for children in Kansas. And so I wanted to know, in general, are any of these recipients reducing costs to parents, to whether it be through scholarships or other methods, reducing or eliminating fees for parents that might be participating?
Yes, they do. I mean, but that's the purpose of helping provide funding for these programs. Without our funds, I think you would see higher costs and diminished service. I don't know. I
I guess
yes.
it's hard. I mean, I guess I'm looking for the quantifiable evidence of that. For example, if you want to go to a school district, and we've got 7 school districts on here, and you want to participate, I think only 50% have to fall within the criteria that are qualified as at risk. That means that students outside of that criteria can participate. So, and school districts can charge fees. So it doesn't have to be completely of no cost to parents. Certainly could be, but it doesn't have to be. So I guess just maybe in the future, can we see the stepping down of those costs for those that need it most? And then my last question is really related to those school districts. You've got 7 school districts. We spend billions on our K through 12 and our pre-K, throw that in as well. And you say that it's evidence-based and data-driven, and I'll just point to one, KCK. And if I just did a quick search, and I don't know how long they've received funds, but I just did a quick search on those students that are at risk, which is a large percentage. And I did it by income, and I also did it by race, and they're really, really troubling. That means, and they're not getting any better, they're getting worse. And so if we're looking at outcomes of students or children that are entering these programs, and by 3rd or 4th grade, you still have 60% that can't read a grade level, that's really concerning. And I guess I'm not in favor of giving to school districts especially when they're not providing any results. And
Well,
two, we already fund pre-K. And so I'm just wondering, what are they doing that's unique to what other districts are already doing?
so that was a lot packed in there. What I would say is for USD 500 in particular, our records indicate that 100% of the families receiving ECBG funded services exhibit one or more risk factors, and 82% of those families had 3 or more. So the criteria in the RFP is that at least 50% need to have risk factors that are identified. It doesn't mean that our grantees are only serving 50% of kids with needs. So it is, each program is delivering a different set of tailored services. Our funds are not, we're not funding the core pre-K programming. We require school district grantees to submit their budget worksheet that they provide to KSDE as part of the annual budget process. There is a component that plugs in the aid available through the school district finance formula. So we are looking at, are they using their 4-year-old at-risk funding first? Are they using special ed funds they're available to use, general operating budget, even the different forms of categorical aid? If they are reporting using, like, what we review is whether there's still a gap in funding to help support the services that they're providing to children. So that's the level of review that we engage in with our partners at KSDE to ensure, to your point, that these funds, which are far more limited than what a school district budget provides, that we are stepping in with funds that supplement the ability to serve those families. As far as outcomes for 3rd grade, I think it's important to remember that we are not yet set up to track these specific children when they start taking state assessments, when they start matriculating through the school district program. That is in the future because of the longitudinal data system that is being it's being built as we speak by KSDE. We are engaged in a data sharing agreement to be able to match our data in, and in the future, when that system is set up and running, you'll be able to really see this population of kids longitudinally over time, so that we can, like, we share the same curiosity about the long-term impact. We do trust that year over year we see kids with demonstrated need improving from the beginning of the year to the springtime evaluation cycle. So we talk extensively in our meetings. Happy to come back to future meetings with more specific information for you to really engage in that discussion.
All right. Thank you, Christy, for the questions. A good line of discussion. And I think we all look forward to that day when we do have the information that can give us direct feedback on the impact on the children that are receiving services through ECBG. Further questions, further observations? Renee.
Thank you. Takes me a minute to get all my buttons pushed to unmute and everything. So I do have a couple of questions. My first one is about the Early Childhood Collective of Douglas County. I just noticed that it's serving 330 children, but 350 families. So I'm just wondering about serving more families than children.
I would I think that's prenatal care that's offered. And so we're not counting those children just yet because they are not directly receiving services, but expectant moms certainly are part of the portfolio of folks, or it's a two-parent household and both parents are engaged in parent education programs or other types of services.
Oh, okay. And that's only true for that one agency, not for any of the others, because none of the others have the families higher than the number of children.
Yeah, I mean, we're relying on the information they submit in their application. So yeah, I would say if that's the one that caught your eye, that is correct.
Okay. My other question, or just more of a statement, is I want to kind of go back. It's a little concerning to me that we haven't already had data tracking the ability of the evidence of the effectiveness. This is a lot of money, and I did the math. If it's correct, it comes out to about 2,800 per child. And if it's year over year, that's a substantial investment. I am very anxious to see the longitudinal data to show that what we're doing is actually effective. So
We are as well, for sure. We are as well. We have already put together the data sharing agreement with KSDE, and we are engaged in the process of matching data. The evaluation teams are working together. So we hope to come back to you with that information, as soon as it's all ready, because, I don't disagree. I think we're around this topic. We have tried to bring you 5-year snapshots of our program, looking at it historically, putting it in that context. But as a state, the system wasn't set up, and we have an opportunity to enhance the availability and use of data in the very near future.
Thank you, Renee. Any further?
I saw John's hand up.
Yeah, it's John Wilson. I have always felt like the early childhood block grant is one of the most rigorously evaluated uses of state dollars, even though they are tobacco dollars, but state dollars that I've seen. And I went to my file of annual reports. I didn't have the 2024 one handy, but I guess I'm a little hesitant to just say that I can't wait to see the evidence to show these programs are working, because we do have evidence to show that individual programs are working. I think what we're looking for is the participation in these programs in a longitudinal way, like being able to track child A at the Family Resource Center whose mom and dad are getting support services, and how that translates to 3rd grade reading or 8th grade math or whatever. I am also looking forward to that. But I know even grantees like TOP in Wichita have longitudinal data showing how impactful their programs are. So just say that I struggle to think of any other state-funded program that gets as evaluated as these grantees do. And I would just say that I think the point about affordability and accessibility of services over time, wanting those to be kind of lower costs for parents or something like that, I think that's really important. I also think it's most critical for childcare, and I just want to. It took me a while to understand the full portfolio of our ECBG grantees, that it's not just childcare, but it's home visiting services, or it's mental health services, or it's other things. So I think in some cases it's not a matter of are they lowering costs for parents? It's literally, are there services or not? And it sounds like without ECBG funding, some services just wouldn't even be available in a community. And so absolutely, when it comes to childcare costs, our investments ideally translate to lower cost for parents, because this is a revenue stream outside of tuition for those programs. But other programs like home visiting or early childhood mental health or those sorts of things, I think they just wouldn't exist, or they'd be huge wait lists for parents. That's all. So that's not even a question. That's just a comment and an observation, and a reminder to myself of the fact that this is early child is lots of different services and not just childcare.
All right, thank you, John. Further discussion? All right, seeing none, we can proceed. Melissa?
Okay, so Lindsay had the slate slides. Lindsay, yeah. So this is this is part of the slate. Board members have this in their packet. We have another slide to fit it all on. So a slight increase over last year, tried to address the constraints of funding against the backdrop of requests. Unless there's further discussion, Mr. Chair.
Further discussion regarding the recommendations for funding for ECBG? Seeing none, Melissa, do you want to proceed with taking action on this? All right.
Yep, I think so.
Okay, and this will be a voice vote. John Wilson?
Well, no,
Oh,
Well,
we need,
can I make the motion that we have?
Yeah.
I'd like to make the motion that we approve the fiscal year 26 ECBG funding recommendations.
That would be a good idea. Do I hear a second? All
Second.
right. Motion's been made and seconded to approve the funding as recommended by staff. John Wilson,
Yes.
Representative Christy Williams,
No.
Dr. Tara Wallace,
Yes.
Deanne Owen Graham,
Yes.
Dr. Leetta Felter,
Yes.
Senator Renee Erickson,
No.
and Cabinet Chair Don Heineman votes yes, and the motion is adopted. Okay, Melissa, you want to move ahead to agency updates then?
yes, we've got our folks. Lindsay, you can go to the next slide.
There we go.
Good morning, everybody. This is Amanda Peterson at the Kansas State Department of Education. I have a couple of updates to share today. When we last visited in February, we were getting ready to bring our slate of Kansas preschool pilot recommendations to the State Board of Education. The State Board approved that slate at their February meeting on February 11th. Next week, the State Board will consider our slate of funding recommendations for Kansas Parents as Teachers programs. So if you are looking for either of those slates of recommendations, you can visit www.ksde.gov and navigate to the page that has the State Board of Education meeting dates and materials. If you have any issues with that, you can feel welcome to send me an email and I can get you to the right place. As a good reminder, I know that we just took a look at this slide, but both of those programs are funded in part by Children's Initiatives Fund dollars. In addition, if you visit the State Board of Education or the ksde.gov webpage, every Thursday our agency shares a KSDE weekly email update. So if you'd like to sign up for those, you can click on the link to do so. I'll highlight a piece that we shared yesterday. If you've seen pieces in the news, I know that there is a lot of federal policy updates to keep up with, but we did share an update yesterday that states had been notified late last week that previously approved late liquidation periods for Education Stabilization Fund resources had been canceled. And so we are following up with the United States Department of Education to request continuation of those funds, which we've earmarked for school improvement and other capacity building and professional development needs. So if you're interested in learning more about that, I would recommend tuning into the State Board of Education meeting next week, Tuesday. I feel confident that that will be included when the commissioner shares his update on Tuesday morning. And as a reminder, you can do that also at ksde.gov by visiting the board page. That's all I have for today.
Thank you, Amanda. Matt Bellinger from Corrections and JJA.
Good morning, everyone. I did want to let everyone know recently KDOC and the JJOC, the Juvenile Justice Oversight Committee, put together a press release and a YouTube video that went out to help highlight some of the grants we offer to communities that help youth that are justice involved or those that are at risk. Had a few news stations pick it up, and we did see an increase of an interest in grants because of that. So really exciting as we continue to get more interest in developing those evidence-based practices in our communities. So that was a good initiative that already kind of gave us some good feedback. Also recently, the Department of Education performed an administrative review of the culinary program that we have at our juvenile correctional facility here in Topeka. And the child nutrition and wellness program, they were really impressed with some of the work that our staff with Aramark Estrella Santos did to help those students become more accomplished as they move into adulthood, and not just accomplished in the culinary arts, but she received a letter of commendation that all the youth were respectful, they were very organized, used good time management, as well as the food safety practices. So something I really enjoy doing is kind of helping those young people move into adulthood, and they're coming out with some more skills that can help them do that. Also, we kind of talked about this in the past, inform the group about some of the work KDOC is doing to enhance the relationships between our adult residents and their young families and consideration for those children. This is not something that I'm deeply involved in, so I've asked Jennifer King, our Director of Public Affairs, to be here. She's going to share some information with you about that. So welcome, Jennifer, and I'll let you finish it out.
Thank you, Matt. Good morning, everyone. As Matt said, I'm the Executive Director of Public Affairs for the Department of Corrections. I'll be brief this morning, but we've got some really exciting news that we will soon be sharing quite publicly, I hope. For the past several years, the Department of Corrections has been exploring the possibility of establishing a nursery at Topeka Correctional Facility that would allow women who give birth while in our custody to keep their baby with them after delivery, as opposed to, for example, having to give up the baby at the hospital immediately after birth. We've made a lot of strides over the past year and a half in this particular effort. There was some discussion about some legislation in the 2024 legislative session, but we all got together and decided that we actually don't really need legislation in order to pursue this. We can do it through our own policies and procedures. So we partnered with multiple organizations in communities, for example, the Kansas Breastfeeding Coalition, the Topeka Doula Project, and we formed a working group to start actually putting on paper what this effort might look like moving forward. I'm pleased to report that we are actually so far down the road that we are currently writing our internal policies and procedures for the implementation of this program. Many states throughout the nation have nurseries in correctional facilities, and those that do have reported a decrease in recidivism because the mothers are able to build bonds with their newborns, and we think that that's an integral part of their success when they're released to the community. So that's where we are as of today. We'll be having some more meetings in the coming months once session is over for 2025. Hopefully, we'll have y'all's support as we move forward with this. There's been a lot of media coverage recently. The legislature seems to be very supportive of this, and I'm grateful to them for that. If you have any questions, I'm more than happy to answer them now, or you can reach out to Matt or myself at any time, and I can provide additional details.
Any questions for Jennifer or Matt for that matter? Jennifer, thank you for that update. That's a very interesting and exciting proposal. I wish you well with that as you move towards operational reality.
Thank you. I appreciate y'all's time this morning. Have a great day.
All right, you too. Next up from KDHE, I believe we have Amy Dean Kampmeyer.
Yes, good morning, everybody. My name is Amy Dean Campmeyer. I am a co-director for the Bureau of Family Health with the Department of Health and Environment. So I just wanted to mention that we are super excited to announce that Kansas will be participating in the inaugural National Home Visiting Week. Many states have done this on their own through years, but there was a push with some nonprofit organizations in other states to make this a national event. We are a part of those states. It will be taking place April 21st through 25th. And this is a national observance is dedicated to honoring home visitors and recognizing their vital contributions to improving maternal and child health outcomes. So we would like to extend our appreciation to Governor Kelly for her support of the home visiting workforce through signing this official proclamation. So I wanted to share that with everybody because we are super excited and really support the work that they are doing. And Derek is on with us as well, and he has a couple of updates.
I do. Thank you, Amy. Hi, everybody. I'm Derek Florlog. I'm the other half of the directorship for the Bureau of Family Health at KDHE. I also did just take on another bureau as well. So now I'm the director for the Bureau of Disease Control and Prevention. Most of my updates today will be focused on childcare. I believe they all are actually. So our childcare regulation updates, just as a quick reminder to everybody, they've been at the Attorney General's office since Valentine's Day, since February 14th. We haven't been contacted yet about additional feedback on those or a request to meet. When we sent what we call our first packet through last year, it took about, I want to say about 3 months before they made it back to us and requested to meet a couple of times for some kind of clerical and grammatical corrections, and had a few questions from them as well about intent of language. And so we worked really closely with their team through that. And I imagine some of that might occur this time, though some of the language that's changed is the same in this packet as well. Just a refresher on this second packet, it's focused on our school age programs, what we currently know as our school age programs and drop-in programs. The intent of these regulations is to sort of streamline that school age group and give them a path to childcare assistance. There really is currently no path that makes them eligible for that. This next packet would, as it has some of the health and safety requirements as laid out in federal rules. So, and these are backed by the providers and partners themselves, groups like the Boys and Girls Clubs, the YMCA Coalition of Kansas, and many more. So we work closely with them, just as we did with our home providers and center providers in preschools to update the language, regulatory language, to be, I say a little more modern, but way more modern. The next is we finished initial interviews for interested parties for our child care zone concept. These are PDG funds that we have got and are directly going to local communities to meet childcare needs that they deem relevant in their area. Gonna have to excuse me as my girls come in here because I just had a little baby 2 weeks ago as well. So I'm juggling kind of parental duties as well. But those grantees, they actually must support at least 2 full Kansas counties. Yes, babe. Okay, one moment. I'll go real quick through this last one here. But those interviews have been completed with next steps to come. We had a recent systems improvement team regional roundtable in Sedgwick County, really well attended, and that was a success. And my last update, the most notable one, is that the federal funding that had been supported, that had come from the governor's fund, unfortunately, that funding has been terminated by the United States Department of Education in a letter from Secretary McMahon. And so we've had to make those childcare fees, licensing, and background check fees effective immediately. We sent that letter out last night to childcare providers and are beginning to collect fees this morning. So just wanted to make you all aware of those changes. And I think that's all I have for now. Thank you for letting me join. And thanks for the well wishes from everybody too. We have a healthy baby boy. His name is Benson. Mom's doing great. And the other 3 siblings are adjusting as well. I don't know if there's bags under my eyes or not, but we're doing our best over here. So thank you all.
All right.
Congratulations, Derek.
Yes, congratulations to you and the rest of the family. Thank you both, Amy and Derek, for your updates. Derek, so you have imposed additional fees starting today. I expect you will receive considerable feedback from providers out in the country. Will you have a way to quantify that and report back to us on that in the future? And what
Yeah.
impact that would have on the programs?
Yeah, well, I mean, I guess broadly what I can say is for the last, I mean, gosh, 4 years, I think in total, we've been able to cover all application fees. And those look differently. Typically, it's about $75 plus $1 for each license slot. It depends on the program type. We did do away with what were called amendment fees. And so if somebody wanted to change their license, we used to charge a fee, and we stopped doing that about a year ago. Background check fees, we, the agency, we get charged from KBI, who I believe gets charged from the FBI to have those ran. Those are about $58 per person. And that's all wrapped up in federal requirements and rules. And so on our end, what we do have access to is, of course, the number of applications we receive, and so we have that data that says, this is the number that we've processed, this is what's been charged and received, and then on background checks we have the data that says how many we've requested from KBI as well. The kicker on the background check and fingerprints, we have to have that fee in hand before we can actually request that it be processed from KBI. So sometimes that's just an additional barrier to say, hey, we received your paperwork, but we haven't received the fee for it. And so we'll see how that goes. I would agree with you. I think there's going to be quite a bit of feedback as the word gets around, and we start to hear from providers who haven't had to do that. There have still been local childcare fees, which our locals can charge, but the state fees has been waived for several years now. So I think definitely a concern. I mean, definitely another potential barrier to somebody not just starting a childcare business, but renewals as well. And so we'll be looking at all avenues to make it more doable for our providers. But we can track those metrics. A very long answer to say, yes, we can track them.
All right, thank you, Derek. Any questions for Derek or Amy? If not, we'll move ahead. Justice Melissa Standridge.
Good morning. Really, I don't have any updates. I gave a big update last time. Things are moving along with our, I think I did. I didn't read, but we received a $750,000 grant for a program. And it's actually going to be administered through Kansas Legal Services for a pilot program in Lawrence in Douglas County for parents to have a parent partner assigned to them throughout the entire case, and from the very beginning. And they will not be affiliated with DCF or a contractor or the court. They're employed by Kansas Legal Services. And the great thing is, I think that's significant here, is that we are partnering with the Family Resource Center, which I know is funded by the Children's Cabinet in Douglas County, to help the parent partner have the parent access all of the things that a Family Resource Center would provide. So we're pretty excited about that.
Okay. Well, thank you, Justice Standridge, for your report. Moving ahead, Director's update. Melissa.
Thank you very much, Mr. Chair. First and foremost, I want to introduce a new member of the cabinet team to everybody. Starting Monday of this week, we welcome Craig Barnes from the Shawnee County Health Department. He moves over here to take on the role of Assistant Director. He fills the gap left when Amy Meek departed last year for the private sector. And I am super excited at the future that exists with the skill set that Craig brings to the cabinet. So we are busy. We've turned on the fire hose, and he is absorbing all of the information at a very rapid rate. But we look forward to his assistance here and contributions. And I personally am grateful because I have been carrying the load with the gaps that have existed, and we've really needed additional manpower. So just wanted to note that and welcome Craig. Lindsay, if you could move to the CBCAP timeline slide. I just want to give a preview to this board that the federal community-based child abuse prevention funding, it's usually roughly $1.5 million. It's a formula grant from the Administration for Children and Families. That follows the federal fiscal year. So the grant year is October 1st to September 30th. We have the competitive grant application is opening up for that program May 14th. The application window closes June 25th. This board can expect that we will bring the slate of proposed grant awards to you at our August 1st meeting, and then would issue the grant award notices once we have received a federal award. So always dependent on appropriation of the funds. But I just wanted to preview that. We communicate through our newsletter, our website, and partners that help share that opportunity. So it's open to the public to apply. We can move to the next slide. This cabinet is the designated Early Childhood Advisory Council for the state of Kansas in compliance with federal law. And in order to carry the expertise we need, we have the standing committee, the Early Childhood Recommendation Panel. That is an annual membership. We accept applications. That window opened April 1st. It'll stay open until May 2nd. People can apply through the cabinet website. Any Kansan, any individual Kansan who is interested is welcome to apply. We do need members of the public. We need parents with children receiving services in the system. We need all sorts of specific expertise outlined in the federal law. So representatives of local education agencies, institutions of higher education, local provider of early childhood education and developmental services. We are supposed to have a Head Start representative. So those specific areas, the criteria is met through this public application process. We also have some required state agency representation. So we'll bring you the membership slate at the June 6th meeting for approval, 1-year terms from July 1st through June 30th, and we do appreciate the people who volunteer their time to serve in this capacity. The panel meets virtually and carries on work. When there is need to bring recommendations to us, they do so. Otherwise, it is just a great collaborative space to exchange information. The meetings are recorded and posted on our website for anyone interested in following along. So I also just wanted to update you that our CIF accountability process kicked off with a webinar for all of the program, the project leads a few weeks ago in mid-March, and then we conduct one-on-one interviews with all of the different organizations through the month of April, spend some time preparing the presentation to the board that you'll receive at our June meeting. And then just a reminder that the Imagination Library of Kansas board will meet. That is the voting members of the Children's Cabinet Board. So as soon as this meeting wraps up, we will exit this meeting and log into the separate meeting link. We record this meeting, and the two need to be separated just because of the logistics of things. So with Zoom, we need a separate login. If we could move to the next slide, Lindsay. Mr. Chair, this is the upcoming meeting schedule. We had earlier in the meeting cycle, we had targeted an in-person meeting October 3rd. I would like to propose that for our budget discussion that we look at meeting. I'd just like to see if the members of the board, including our advisory members, could we meet in person here in Topeka on June 6th rather than doing it virtually. I just wanted to get a sense of the board's availability.
And so the proposal is to change our once a year in-person board meeting from October to the June 6th meeting. And the reason for that is to consider in depth the CIF budget.
Yes, the recommendations for next year.
Yes. Input from board members. Will this work for you, June 6th?
This is Deanne. That works fine for my schedule.
And this is John, works for me as well.
This is Monica. I'm sorry, I'm out of state that day. I had planned to attend by Zoom.
This is Tara. That works for my schedule as well.
Christy and Renee, June 6th in person, does that work for you?
I was just pulling up my calendar. It looks like that would work.
It works for me.
I think so.
That's great. And if I may, Madam Chair, for the Education Task Force, the first Friday of the month is the one day of the week that obviously we have this conflict in alternate months. So as you are putting together the meeting schedule, that would be my input for you.
It will not be on a Friday. It will be a
Great.
Tuesday, Wednesday, or Thursday of the first week of the month.
We will move whatever needs moving to make that work. Thank you.
All right, good. It appears that June 6th in person will work for the majority of the board, and Monica will participate by Zoom.
We'll figure that out. We'll make sure the
All right.
technology.
All right. Any further business to come before the meeting?
That is all I had.
All right. If I will declare the meeting adjourned, and please log out, board members, and then log back in for the Imagination Library meeting.
Thanks, everyone. Thanks to all the staff who did the prep for today to bring us the updates.
Yep. Thank you all.
Thank you.
Thanks, everyone.
And welcome, Craig.